Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about muscle strains. So, commonly when you actually are talking to individuals, they've heard about sprain. So you say, okay, yeah, I've sprained my ankle, or I've sprained my knee or my shoulder or whatever, but they don't always know what to call it when they injure a muscle. And so a strain's going to happen to a ligament or to a joint, right? So you can strain joints, and a sprain happens, or a strain happens when it's a muscle. So if you can strain a muscle, or you can strain a tendon, and a muscle strain is actually a similar type injury where you overstretch a muscle, or you injure it in such a way that it becomes inflamed, painful, and tender. Common strains that happen in the lower extremity, for example, could be a calf strain, where you're running, playing some sport or something, and you step funny and you feel the muscle pull, and it goes into severe pain, but it's not an injury to the tendon where you say, okay, I didn't tear the tendon or anything like that. It's actually physically in the muscle, and you strain the muscle, like we said, it gets inflamed, painful, and tender. So what are the options if you were to strain a muscle? What do you do for it? You will treat it similar to as you would a sprain. So you're going to say, okay, for the muscle, I'm going to ice it. I'm going to compress it, so put compression around it to minimize swelling. So I guess easier, let's make it a simple acronym. Let's remind you of the simple acronym that will help this. RICE, rest. You want to keep moving the muscle, because the strain is actually going to continue to be a problem until you allow it to recover. And strains can take anywhere from 2 to 4 weeks to completely resolve, although some of the milder strains will improve pretty quickly, and they won't interfere. So rest, ice, compression. So ice and compression are both used to decrease swelling, and as you decrease the swelling, you also decrease the pain. And elevation, so you actually change the blood flow to that area to, again, minimize the swelling and so forth. This is the most important the first day or two. After that, you're working on minimizing re-injury. So you say, okay, what can we do to protect this and to make it so we're not re-injuring it? Sometimes with a good calf strain, for example, if it's the gastrocnemius muscles that were strained, we may need to put you in a boot to minimize motion, so you're not stretching that muscle constantly every time you step, every time you walk. Some of the smaller muscles, you really don't have to protect as much. But the idea, you want to minimize injury, you want to decrease the symptoms by decreasing pain and swelling, and that can be done by ice, compression, and even sometimes non-steroidal anti-inflammatories like Motrin or Advil. And then you want to give it time to heal. There are some ways to speed up healing of a strain. One is the MLS laser. That's probably the best way to speed up healing, because it aggressively decreases swelling, aggressively decreases pain, and at the same time will cause the cells to heal. Because a strain in a muscle is actually many tears in that muscle that cause the symptoms and cause the pain, and so you need it to repair itself. So that's probably the best option as far as speeding up the process. There are herbal medications like Dr. Christopher's Bone and Tissue that will actually help the muscle strain heal quicker as well. Big idea, limit the pain, treat the symptoms, and don't re-injure it, and that will help quite a bit. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 58. Thank you, and have a good rest of your day.